In today's episode, we hear an extraordinary and deeply personal story from Claire, a mother, a wife, a carer, and a survivor. Claire takes us on a powerful journey through decades of living with undiagnosed Factor V Leiden, from the pain of multiple blood clots to a life-changing stroke while caring for her husband with dementia. This is not just a story about blood clots, it's a story about misdiagnosis, resilience, and the ripple effects of one young GP asking the right questions at the right time. If you or someone you love has ever experienced unexplained clots, pregnancy, complications, or stroke, this conversation could change everything. Let's begin.
Welcome back to Thrombo Watch with Dr. Aman Sharma and me, Louise Thompson. We are incredibly privileged today to be joined by a special guest who is going to tell us her own story of how Factor V impacted her life over quite a period of time, actually. One thing that I've asked Claire to get into with us is how it felt, both physically and emotionally, because that's the thing that you can't pick up from a textbook or from information that the medics provide. Claire, tell us, how did it start for you?
I think the first time I had a DVT, I knew nothing about Factor V Leiden. It was in 1974 when I'd just given birth to our daughter, and the DVT started about 3 days after her birth, and it was absolute agony. It was in my right leg, and I couldn't put my foot to the floor, and they didn't give me anything like Warfarin because I was breastfeeding at the time, and they said, don't worry, it'll go away. And after about 10 days, I went home, but I had great elastic stockings from my ankles right up, and it was really painful. Bit by bit, it seemed to subside, and I thought that's all done and finished and sorted out. But 3 years later, I was pregnant with our son, and I got DVT again. So I ended up in hospital, and I couldn't again put my foot to the floor, and I thought, this is really painful and horrid. After his birth, everything seemed okay, and life went on, and it wasn't until he was 18 and going to university, and I got another DVT. But the year before, I'd been put on HRT, which now I understand was about the last thing I should have done. So I was back again in hospital, not able to go with him for his first day, drive him up, be with mum and everything. So my husband went, and that was really painful. And they put me on Warfarin for a short time, and I thought, that's all done and dusted. The next time I was aware of anything was when Caroline, my daughter, was pregnant, and she had a lovely young female GP who checked past medical history of the family and said, has anybody had any clots? And she said, oh, Mum.
Yes.
So they said, okay, we better check you. And so she was found to have Factor V Leiden, which was heterozygous, which is, I think, from one parent, viz. Me. And she said, actually, you ought to be tested, Mum. And I thought, oh, what's it going to do to me to be tested? I thought, all right then. So I went through the whole thing, which wasn't difficult, actually. And I then found that I was homozygous. I had it from both parents, which seemed to be terribly unfair somehow, because I have a twin sister who we're not identical, but she doesn't have it at all. Oh, she has never shown any signs of it. I have an elder brother and sister, and they've never shown any signs of it. So I thought, hey, I've got two dodgy
Yeah, you've got it all.
cards. Yes,
Yeah.
I think that's life. But it had only been discovered, I think, in the town of Leiden in the 90s.
That's right.
So actually, I was really quite lucky to have got on the bandwagon.
That GP that you talked about, the young
The GP, she
female
was
GP.
young, yes. And actually, you know, what a gift she gave to Caroline and what a gift she gave to me. And of course, our son has it because I have double. But there are one or two cousins who have got it. So I said to my family, if any female is going to go on the pill, be careful. And there was a sort of intake of breath all
You can't
round.
talk about it. You're not supposed to talk about teenagers going on the pill.
No, and
But
my
it's important
sister-in-law
that they
said,
know.
"Oh,
It's important that they know.
exactly."
And what tends to be the case, oh yeah, but it's only for painful periods, or it's only for acne.
Yes,
We don't care what the scenario is. Just be careful about
Yes.
going on the pill
yes.
if there's a chance that you've got Factor V Leiden.
That's right.
So we have to talk about it.
I think it's really important because it's life-threatening, I believe.
It is.
And subsequently, I had a hysterectomy because of a prolapse. And they operated and they discovered that I had, what's the expression now, a great many very small pulmonary embolisms, which are the little things in my lungs. And I thought, have I been walking around with these things? Because the warfarin had only been short-term before. And so I was then put on, first of all, warfarin, and then subsequently I was put on Apixaban, but which seems to have taken over from warfarin.
Yes.
And the thing about warfarin was I had to go into the hospital every so many weeks and have a blood test and then break a pill. It was quite complex, at least I thought so. How many of what in the morning and what in the evening? And I thought, oh dear. But I think really the most tricky thing was I think I was still on warfarin and I had a stroke. I was looking after my husband who had dementia for 12 years.
Sorry to hear it.
And as a carer, I found it difficult and it was exhausting. And there was one day I thought, should I leave him or not? I wanted to go down to see my daughter who had sepsis. And she had been in the local hospital and just discharged. And she had 2 children who were school age.
This is Caroline.
Primary. This is Caroline, primary. And she was very weak and she was really, and I had been absolutely terrified when discovering she got sepsis. And so I said, okay, I'm going to leave my husband. It's a kind of balance.
Tough decision.
And I got the bus down and I picked up the girls and I took them back to her home where she was at and I gave them some supper. And I thought I must go and get back to my husband. I hope he hasn't done anything because he did all sorts of very unpredictable things. And I actually felt quite guilty having left him, but I thought her need was more. Just before I left, my son-in-law got back from work and I set off and I was on a bus and suddenly I couldn't use my right arm and I wanted to phone my husband with my mobile to say I'm on my way back because he could well have been in a fluster. But my arm, I couldn't move it and I had a very strange headache. I felt very woozy, very odd. And I thought something's not right and I couldn't focus properly. So I don't know why I got off the bus. Somehow I got off and I ended up sitting on one of those narrow seat things at the bus stop. And I tried to put the phone here and do it with my left hand. And I'm not ambidextrous. Somehow I got through to Caroline and she said, Mum, you're having a stroke. Your voice is you're not speaking clearly at all. Your language is very odd. And so she said, stay talking to me. And Bob, her husband, who's a gem, organised an ambulance. And I was really very odd. And somehow or another, I couldn't explain where I was because I was so confused and all over the place. Anyway, he got on his bicycle and found me at the bus stop and had told the ambulance they thought that's where I was because the poor ambulance didn't really know where they were coming because I was so...
On a bus route. Somewhere on a bus route.
Somewhere on a bus route, yes, in North London. Anyway, they scooped me up and they took me off to the Royal London and they managed to get my medical notes. Caroline, somehow or another, I really can't remember quite how. Anyway, they knew that I had Factor V Leiden and that I was on I was on warfarin at that time. and they did a scan. But the strange thing was I'd had a bleed in my brain rather than a
Than a clot,
blockage,
yeah.
rather than a clot, which I thought it would have been. And Bob stayed with me, and they kept me in mercifully only for a week. And eventually I began to be able to use my arm again. But it was really frightening because I thought, I've got my husband with dementia. I was supposed to be looking after him. And I really think that the stroke was caused by the pressure and the anxiety of Caroline and my husband. And I think at the time I was really tired, I was drained when it happened. I think it's not easy looking after somebody with dementia, and he'd had frontal lobe dementia and it had changed his personality, and I was not in a good place
No, exhausted,
at all. I was exhausted.
sad, grieving, all of those things.
Yes, I think so. I was really very lucky, actually, that I escaped with a minor stroke, because it could have been awful. And actually, my husband had a stroke 2 years before, which is another story, nothing to do with Factor V Leiden. Yes, it's not been an easy ride, really, but I'm on Apixaban now, and fingers crossed, everything is going according to plan.
You're here telling us this story, which we are incredibly grateful, and you look and sound amazing. So thank you, incredible. But I've got some questions, if I may, and then
Yes.
I'm sure Dr.
Right.
Sharma will have some other questions.
Sure.
But when you had the first DVT,
Yes,
after you'd had the
Yes.
baby,
yes.
did you think this is a normal part of pregnancy? Did you look at all of the other women in the labour ward or the maternity unit and they didn't? Or was it more
No,
common?
I couldn't understand it at all. But then I was told, oh, don't worry, in Victorian times, they used to call it milk leg. So when you start producing milk, this is what happens. And yes, it happens to some people and not to others. So it's nothing new. And you just have to bear through it and get on with it. And we lived in a tall, narrow house. So I was carrying this baby up 3 flights of stairs with these long elastic things in the pain and stuff. It wasn't easy.
No, really
Up to our
difficult.
little flat on the top.
Yeah. So just one of those things is the first thing that I spoke about. That's what
Yes.
people said to me when I was having just one of those things.
Yes.
My dad's blood clot, just one of those things. My
Yes.
grandma's stroke, just one of those
things.
It takes a long time to figure out
Ouch.
what's behind it potentially. So then you had your next DVT.
Yes.
So did you then think this is happening to me repeatedly, or did
Yeah,
it
I
still seem
thought-
just one of those things?
I thought, strangely enough, I was more concerned about the Caroline was all right, because I wasn't being mum and there, and she was 3 years old. And so we had to sort her out, and she had to go down and stay with my brother and his wife, and she didn't know them terribly well because my husband was working and couldn't do full-time looking after her. She had to be decamped, and so I was lying in bed worrying about that. And then I thought, I hope this baby is all right. And so in a funny way, I was more thinking about the outside world, I think, really, rather than why has this happened to me? And nobody had
Just
any
coping.
answers.
You were just coping.
I was just coping, really, and nobody had any answers. It was just one of those things, and some people have them and some people don't.
And then science moved on a little and caught up.
Yes.
I've got one more question, if I may, about your parents, because you said you've got
Yes.
a copy of the gene from each parent. Did they have any symptoms? Or...
My father actually died he had a stroke, subarachnoid hemorrhage or something, and then he died of a heart attack. My mother had, I think they're TIAs, little tiny strokes, but no major stroke. And we didn't connect anything of that
No.
at all. It was a world we were all oblivious to what was going on. So I do think I am very lucky to be in this generation with so many other medical things, but particularly this, because it's begun to make sense of it for me. And I'm absolutely clear of having one Apixaban in the morning, one in the evening, and I never miss one because I think, in this country, how lucky I am. We've got the NHS, the research was done in Holland, but we've benefited from it. And I feel very blessed, actually, that I've got Apixaban. I probably might not be here to tell the tale if I hadn't.
We are so glad that you are here to tell the tale. And what a brilliant way that you've told it that will help other people. So we are incredibly grateful, Claire. Thank you so much. Thank you.
I hope it does help other people. But I think the message I would give is, if you're uncertain, go and ask and try to get an answer. I think I was lucky it happened to me via my daughter. And so the more people who can be identified, the better, really.
Absolutely. I'm going to vacate this chair and hand over to Dr. Sharma.
Okay.
Claire, it's been an absolute pleasure to hear that story, although it was difficult. I'm sure it's not pleasant for you, but telling it has been so important. Thank you.
Okay, thank you.
I'm Dr. Aman Sharma.
I'm Claire, and I have Factor V Leiden, and it's homozygous, so unfortunately I inherited it from both parents. But for years I've been on Warfarin and then Apixaban, and I'm still here to tell the tale, and I'm almost 83 now. So it's been of huge benefit to my life.
Absolutely. So guys, Claire is being too humble. She's 83 years young. She's fought all of the main terrifying blood conditions. She had a DVT, she had a PE, she had a hemorrhagic stroke, but she's not given up. She's taken the blood thinning medication, she's gone through the journey, and here we are listening live from Claire. So Claire, I'll give you the opportunity to ask me anything if you would like, and then we can go ahead.
I think I've got one question. That I recently had some back pain. I'm thinking it was muscular. And I know that I'm not supposed to have ibuprofen, is that the name?
Yeah.
And then I looked up and I wasn't supposed to have paracetamol. And so I was thinking, what could I take? A painkiller which would be safe to have with Apixaban. So I would really like to know what I should keep in the cupboard in the bathroom. If I don't usually get a lot of pain, but I think I pulled muscles or something.
Okay, brilliant question. So we all have pains and aches, isn't it? Any age, be it me, you, anyone. Yes, good question. So you have two components there. So number one, paracetamol. As we consider, paracetamol is amongst the safest painkillers available throughout the globe, right? But yeah, with paracetamol, we have to be kindly considerate in the amount of paracetamol that one is taking.
Right.
That's why we see if the kids have paracetamol, they've got the bottles have very clearly written, take 2.5 ml if your body weight is this, 5 ml if your body weight is this. But usually for grown-ups and adults, if you're over 50 kilograms, you can have 1 gram of paracetamol 4 times a day. That's a standardized dose to it. People can take it as and when required, which we call as PRN. But yeah, that's the more or less. Yes, what happens is, because the paracetamol gets metabolized or breaking down in the liver, if you're taking other medications which are also utilizing the liver to break down the active metabolite, or your liver is not in a great condition, as people who've got cirrhosis, liver cancer, these people, the liver is not that great. So of course, for them, we need the dose modification for hepatic or liver impairment. But most of the people, they can have paracetamol that should not cause any of the side effect. But yeah, if someone has taken it beyond a certain threshold, which people who've got toothache or body ache, they take paracetamol at a lesser interval, 2-3 hours, they'll take 1 gram, 2-3 hours. So that can cause a staggered overdose. That should be a bit precautious. People who have taken it should go to the A&E, otherwise it can cause liver failure. But it doesn't cause in the normal dose range. Second thing that you asked was ibuprofen. So whether it's ibuprofen, whether it's naproxen, whether it's diclofenac, all of these medications are called non-steroidal anti-inflammatory drugs. Their basic job is to reduce inflammation. That's what it does. So when you've got pain, like you've got a muscle pain, there's some inflammation in the muscle, you call it myalgia. If you've got pain in your joints, you call it as arthritis or arthralgia, whatever. So depending on where the pain is, you'll name it accordingly. But the NSAIDs like ibuprofen, naproxen, reduce the inflammation, thus reducing the pain. But what happens is people who are taking blood thinning medications like yourself, any of the anticoagulants, be it Apixaban, Rivaroxaban, Edoxaban, Dabigatran, Warfarin, even the injectable ones, as we call as enoxaparin, this basically increases your bleeding risk. So if you take these ibuprofen, they have a potential of causing an ulcer in your stomach. So if you take it on a very prolonged run, they can cause ulcers, and ulcers would bleed. If you're taking a blood thinning medication, they will bleed a lot more. So you would vomit blood. You'll have poo, which is dark and sticky, which we call as melena. So these are the basic risk factors. So I'm not saying no one can take it, but yeah, they have to be watchful for the bleeding. Also have to be watchful for the kidney functions, because these medications, they go into the kidneys, and that's how they get metabolized or they get broken down. So if they're taking at a very high dose, it can cause kidney problems. Now coming to a safer alternative, as you were asking me earlier, what should we have? People can have codeine, okay, but again, it has to be your doctor has to prescribe it. You can't get it over the counter or from the hospital, okay. Only, I would say, big side effect in the elderly people is constipation. That would cause further pain. Unfortunately, yes, codeine does carry that risk, but at any point of time, paracetamol, the safest drug. Yeah.
Okay.
Okay. So coming to that, I would also like you to ask a couple of questions. When I tell people that they need to go on the blood thinning medication, first reaction is a bit of anxious feeling, oh, they're putting me on something. And we do tell them, oh, this might cause bleeding. You might have a potential bleeding if you fall down. When you started on the rat killer medication, the Warfarin, how did it make you feel?
I thought the fact that it was a rat killer thing was rather scary, actually. But I thought, if I don't do this, what are the options? Because it was really, I felt quite scared about not having any medication to try and sort it out. And I thought, no, I'll go ahead with it and see how it goes and try it out. I didn't want to be left no way of protecting myself, actually. And it was a bore because I had to go into the hospital quite frequently for blood tests, and then they would check what my INR
levels
is.
Yeah.
And so I had to sit around a bit and wait. But no, actually, the system basically was very efficient, I think. I would recommend anybody who has bleeds or DVTs or whatever, or is worried about that, to go and to be tested. And also, if Warfarin or Apixaban or whatever is recommended, I would definitely take it. Nothing is perfect in life, and it actually has been a godsend to me. It really has. I think it's probably saved my life.
Absolutely. And I think compliance and adherence to the medication also is a very important factor, which you have been brilliant at. So did you suffer any obvious side effects when you were taking Warfarin, for instance?
Not that I can remember. No, I didn't think so. I think the thing that I had to do was to work out. They told me how many different coloured pills I had to take. So I had to be really careful as I was doing the right thing, because they altered, depending on the blood test, the dose did. And so I had to be really sure that although last week I was taking X, then this week I needed to change it a bit, possibly.
According to your blood test.
Yes. So I did have to be really careful. The Apixaban is just 1 in the morning, 1 in the evening, and I don't have to think any more about it.
So when were you switched from Warfarin to Apixaban?
I think Apixaban when I had my stroke, which was 2017. And so I've been on Apixaban ever since then.
Okay.
And everything seems to be...
Do you report any obvious side effects taking Apixaban? Any headaches? Any trouble?
I don't think so, really.
That's really great, because in clinical practice, I've seen a couple of patients who were taking Apixaban. We had to switch them to Rivaroxaban or Edoxaban. There's essentially the same group, but if you had some vague pain in your leg, if you had a bit of headaches, you were even feeling short of breath and stuff. But really glad to hear that you did not have to go through all of those.
I'm very lucky.
What are your thoughts about wearing the stockings, the tight stocking?
Ooh. I didn't like it. They were difficult to get on and off. They were uncomfortable, But I think that's really because I had a DVT or it was going away when I wore them, but they were necessary.
Yeah.
And if I've been on an aeroplane, I've always been terribly careful to have the right stockings on a plane and to do the exercises with my feet and pretend I'm a ballet dancer and point my toes and all that stuff. So probably people think I'm a bit dotty, but I'm sitting there going up and down with my feet to keep the blood going up and down so as I don't get a DVT. And also drinking enough, that's the other thing I have to try to remember, but particularly on an aeroplane, not to become dehydrated.
Yeah.
I have to remind myself to do that. For everybody, they should be hydrated, but I feel I better be careful and make sure that I really am drinking enough.
I think what you did brilliantly, Claire, was you knew you had these shortcomings,
Right.
and it did not make you slow down or give it up. You actually nurtured the learnings you had from these. Because yes, if you get a clot once, you do have the signs and symptoms, and you're aware more the next time. Similarly, you were aware that yes, the dangerous factors would be dehydration, immobility, skipping the meds. So you made sure none of them happened during all of this. Okay. One of my last questions to you now, Claire, is you had all of these conditions. Did you ever feel like you should just quit?
No.
Okay.
No, I never did. I felt that nothing is perfect in life. Why do you feel that you should have an ideal medical history? People have things which are so much more frightening, scary, life-threatening. And I thought if you follow the pattern that you're supposed to follow, that should protect you, and you're jolly lucky that what the pattern is that you should do. And so it's really up to you to follow the instructions. I was brought up to do as you're told. And I think it stood me in good stead with this. After all, it's one part of one's life. And the important thing is to live the rest of it. So if you toe the line with this bit, then hopefully the other bits will all fall into place.
Absolutely.
Don't know.
Absolutely. Yeah. So Claire, it was such a lovely experience to have someone so inspiring to be here on Thrombo Watch, because as I said, stories are sad. Whenever someone has a health condition, it's of course not a pleasant sensation for them or the family. We as physicians also feel bad, though we don't show it that much, because I would say we just want to stay neutral and still do the care that we're supposed to. But we also feel it. But the way you've resonated and reflected upon all the the lows that you were thrown at, and the way you've picked up, and even when you're having the stroke, the thought process were, oh, my husband needs me because he's got dementia. So all of these things are so inspiring, and thank you so much. Ladies and gentlemen, as our living legend Claire has rightly told, if you've got blood clots, don't be afraid. If you've got stroke, don't be afraid. If you've got any health problems, don't be afraid. Get up, fight it, get on your meds, get on a good life, and this too shall pass. So we'll see you in the next podcast. Thank you so much.
This podcast is for informational purposes only and does not constitute medical, legal, or financial advice. The views expressed are the personal opinions of the Thrombo Watch team. If you think you may have developed a blood clot, please speak to your healthcare provider urgently. Health-related information shared in this podcast, including text, graphics, images, and other material, is intended for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your doctor or another qualified healthcare provider with any questions you may have regarding a medical condition. If you believe you're experiencing a medical emergency, call 999 in the UK. For less urgent support, call